Welcome to Collide Health Medically Speaking. Each month, we'll explore a variety of topics to help you better understand certain medical conditions and treatment options. My guest today is Dr. Meeghan Lautner, a breast cancer surgeon at the Buffalo General Medical Center. We'll be discussing breast cancer, mammography, and genetic testing. I'm Mike Hughes, and this is Medically Speaking. Dr. Lautner, thanks for joining us today.
Thank you for having me.
We're here to talk a little bit about breast cancer today, but before we get into that, tell us a little bit about yourself. I know you're fairly new to the area, so tell us a little bit about yourself, how you got here to Western New York, and a little bit about your background.
Sure. So I'm a fellowship-trained breast surgeon, and we relocated to Western New York about a year and a half ago. I did my general surgery training at the University of Texas in San Antonio, and then I went to MD Anderson for a breast surgery fellowship, and then went back to San Antonio and was on faculty there for a few years before we relocated here. And this is closer to home for me. I'm from Michigan originally, so that's where my family is. So just a quick trip across Canada, and we make it home.
And you came to Buffalo and joined Collide Health. You saw the opportunity on the oncology side. Tell us a little bit more about that opportunity and what some of the things you guys are doing to change that dynamic.
Absolutely. So I'm an assistant professor with the Department of Surgery at UB, and my clinical practice is run through general physicians, and I do all of my surgeries at the Collide hospitals. And so we just really wanted to provide another opportunity for patients for breast cancer care, and also just sort of expand the reach so that we have options available for patients both in the downtown area and the suburbs.
There seems to be a higher prevalence of breast cancer in Western New York. I don't know if you can tell us a little bit in terms of the statistics, Western New York or upstate New York versus other parts of the country. But there's definitely a need for expertise like yourselves.
Absolutely. So the statistics really nationwide are what are mostly concerning. So every woman has an average risk of developing breast cancer of about 12% in her lifetime. So that translates to about a 1 in 8, every 1 in 8 women could be diagnosed with breast cancer. It's not, I haven't heard any data that it's higher in Western New York. I think it's just one of the diseases that has become so well talked about and unfortunately touches a lot of people. So everyone knows someone or has a family member that's been affected. And it's just really, really sort of rampant nationwide. And that's why it seems like everybody is developing breast cancer, everybody knows someone, but it's important to have those services available in any obviously big city area, as well as reaching the rural areas. It's important to have those services available because if we can detect it early, then that what allows us to save lives.
So you mentioned how well known breast cancer is, but also I think the education piece has improved, over the last maybe 5, 10, 15 years. Talk about education and then why early detection is so important.
So absolutely, and you're exactly right. It's much more talked about than it was years ago. So we see patients all the time who aren't even sure if they have a family history of breast cancer because it really wasn't well known. People didn't talk about it. It was very much more of a private matter. So education is very important because we know that breast cancer survival is very, very high when we can detect it early. So patients need to know about their family history. They need to know about their own personal breast cancer risk. They need to talk with their doctor about when they should be getting mammograms. On average, we recommend women start around age 40, but when we get into families that have a lot of people affected by breast cancer, we may actually start earlier than that. When you have a family where no one is affected by breast cancer, there may be the option of starting later, according to some of our big organizations in the country. But the most important thing is that people are talking about it, people are aware of the risk, and that if we do what we're supposed to do in doing mammograms early, we can detect the disease very early, and that improves our survival rates tremendously.
So you mentioned awareness, education, the mammogram itself, but women still have to take action. They still have to go through that process, and it's not an easy process. No. There's stigma to it. Patients can be afraid. Why is it so difficult, and what are some of the things that you can tell us about which may make it a little bit easier for patients to go through that?
Absolutely. So breast cancer, I tell patients all the time, is very much a spectrum. So the first thing a person thinks of when they hear the word breast cancer is, a patient who's dying, who doesn't have any hair, who's very sick, can't get out of bed. And really, that's really a minority of our patients. It's not to say it doesn't happen, but the vast majority of our patients that are diagnosed with breast cancer are in fact early stage. which means they can maintain their job, they can maintain their other daily activities, being moms, being wives, sisters, whatnot, and it really doesn't have to have that profound of an impact. So you're right that patients are really very afraid. There is very much a stigma associated with it. And so what I counsel patients all the time is that this is not to disrupt your life completely. We may slow you down a little bit as we get you through treatment, but in the end, the goal is to get you back to the life that you want or the life that you had and keep you around for as long as we can. So I really counsel patients to rely on their breast cancer team and to have faith in us that our goal is really to get you through this and keep you alive.
Sticking on the mammogram topic, what is 3D mammography and why is that so important to the practice that you're involved in?
So 3D mammography is a relatively new technology that really kind of just looks at the breast with more of a fine-tooth comb than a conventional mammogram. It's pretty widely used and pretty widely available nowadays. It's not to replace the regular mammogram, and it really just helps us to maybe reduce calling patients back for more images. And there are some research to suggest that it's finding cancer slightly a little bit earlier than conventional mammogram. So it's really just an improvement on the technology that we've had for a really long time. And so it's available across Western New York for the most part, I think almost at every facility, and is an important option for patients, particularly those with dense breasts.
So imaging becomes that much more vital to the patient and their potential diagnosis, or the fact that they may go get their mammogram and get a clear report. So why is imaging why has it gotten so much better? Why is it that much more important these days?
So our technology has improved, obviously, in every aspect, and so it translates to our imaging modalities, not only for breast cancer, but for medicine in general. And so we're just getting better and better with our technology, and that allows us to find cancers much earlier, which allows us to get people through treatment much easier without disruption in their life, disruption in their flow of their everyday activities. And it makes it much easier to treat and offer more options. So it's of critical importance that women are getting their mammograms when their doctor recommends that they do, and understand that as our technology is getting better, the key is to find something very early before you can feel it on exam or before they notice anything on the outside.
Genetic testing has become an important part of the breast cancer field. Why is that? And can you tell us a little bit more about what it is?
Absolutely. So genetic testing is another modality that we have to give patients, particularly the breast cancer patients, some information as to potentially why they may be diagnosed, but also is vital information for how we're going to proceed with their treatment. So genetic testing basically looks at a patient's DNA to see if there is potentially an area that's spelled wrong. And if it's spelled wrong, it doesn't work correctly. And the most common genes we hear about associated with breast cancer are the BRCA genes or BRCA genes. And those, in fact, are actual normal genes that all of us have, but in the BRCA patients, those genes aren't spelled correctly and they can't work. And their job is to prevent cancer from developing. So when they can't work correctly, those patients are at really high risk. And so when we start to see patients that have a very strong or long family history of breast cancer or ovarian cancer, we get suspicious about these type of spelling errors or mutations. And it's critical to get that information up front after a diagnosis. And so if someone were to have a strong family history, we typically will refer them to our nurse practitioner, Karen Gutierrez, who does our genetic counseling and testing to see if they're a candidate, see if they meet national criteria, and then she helps facilitate the testing, which is either a blood draw or sometimes even a spit test. And then she works with the patient insurance companies and whatnot to get the testing through. We're lucky now that there's several labs doing the testing, which has really expanded it, made it cheaper for those that have to pay out of pocket, and really just giving us a lot more resources for that. So it's critical information.
So that's somewhat of a newer development in your field, but it's something that you see probably being enhanced or widen as you move forward.
Absolutely. So I mentioned the BRCA genes, but that's just 2. And so pretty common now, we have on the upwards of 17, maybe more, that we know can be associated with breast cancer and other cancers. So it's not just breast and ovarian. We start to see family history that has several people affected with cancer, prostate being a big one. We see some linkages there. So all of that is really critical information, not only for a breast cancer patient, but for any cancer patient to understand if the genetics genetics is a component of their disease. In addition to that, patients who may not have cancer but do have a strong family history, genetic testing allows us to really interpret what their risk is and what we might need to do moving forward to either watch them more closely or institute measures to help reduce that risk. So it's important for patients with cancer, but also with those that just have a strong family history.
Got it. People may not realize how many procedures are done at Millard Fillmore Suburban Hospital. I know in your short time in Western New York, you've built a pretty bustling practice at Buffalo General Medical Center. Can you tell us more about the Kaleida Health facility, some of the resources, and some of the programs that are associated with the two sites?
Yeah, so at Suburban, we have a very robust breast surgery service line in the operating room and obviously throughout the hospital. And so when I arrived, we kind of identified Buffalo General as being an area where there was definitely a need for the patients in the downtown area and even the south towns where that's much easier for them to get to. And so we essentially are working to mirror the service line at Buffalo General, just like we have here at Suburban, and offer all of those services. So we have a new mammogram unit there at Buffalo General where we're offering screening mammograms as well as diagnostics and even biopsies, and then also have brought breast surgery back to Buffalo General where it hasn't been for several years. So that really, throughout the Kaleida facilities, the options are equal at both places.
So as we close up, when you talk about Breast Cancer Awareness Month, every October, I think people in general realize that that's an important awareness and educational piece. But really, it's a everyday 365 education that's needed for females. So what type of advice do you have for patients? What do you recommend? Do you have a constant talk that you have with your patients, some sort of elevator speech that you give?
I do. So, it goes back to the most important thing that every woman is talking with their doctor about when they would recommend they start getting mammograms, if they haven't already, and if they are getting them, how often, and just making sure that that's something that's on the calendar every year. October is a great month for that. Most people get their mammograms in October because it's everywhere and it's easy to think about. So that's a good reminder. But you're right, it is something that every day has to be something in the back of everyone's mind to make sure that they're on track with all of that. And the elevator speech is there's a lot of things about your overall health that contribute to breast cancer risk. So maintaining a healthy diet, an active lifestyle, not abusing tobacco and alcohol daily, all of those things contribute to a lower breast cancer risk. And then for my cancer patients, I remind them that will help them not only get through treatment, but decrease their recurrence risk as well. So overall body health contributes to breast cancer risk reduction, as well as it does helping folks get through treatment. So the main thing is that it is something that people don't feel embarrassed or ashamed to talk about, but are really speaking about with their doctor to making sure they have a good plan for their mammograms and a good schedule.
Dr. Lautner, thanks for joining us today. We appreciate your insight on this very important topic. Congratulations on the program and all the success that you guys have had thus far.
Thank you.
Thanks for joining us today.
My pleasure.
I'm Mike Hughes. We'll see you next time on Medically Speaking.